We are looking, as we speak, ladies and gentlemen, at the biggest story of medicine of our times. It's called GLP-1. We're looking at the fastest growth in a pharma industry, thanks to, again, GLP-1. This is a drug that has captured boardrooms, living rooms, even courtrooms. So what exactly is GLP-1? What does it do to our bodies? And I don't know if you know it yet, but everybody sitting over here, history is going to write down and talk about us as the generation of GLP-1. You just don't know it, but over the next few minutes, we'll tell you just how. Today, I'm very glad to have on this discussion with us, for the very first time, all the key stakeholders on this weight loss journey. Let me quickly bring them up on stage. India's leading endocrinologist, somebody whose word is taken even by the Prime Minister. Dr. Muffazal Lakdawala is here with us. Please join him on stage. And I'm very glad to have on stage people who often decide not to come in the limelight, but today they have. Let me please bring up on stage Nirav, who's been on GLP-1, has been on a weight loss drug for the past 2.5 months, and also Blanche, who's been on the weight loss drug for the past 6 months. All right, so who do you see on stage? You see the doctors, you see the patients, and you also see the pharma company. And I'm so glad that for the first time, like I said, we have all the key stakeholders to share their story, share their struggles, and also tell us what the future is going to look like with weight loss drugs. Let me give the first word to the doctors here. So we are in this very peculiar time when it comes to weight loss drugs. So can I, just for the benefit of our audience, understand this first? Who do you think weight loss drugs today are for? Who is it for?
So we are in a very, being a surgeon, I can tell you, this is the first time ever in history. And that's why I love the way you say we are living in a GLP-1 generation. For the first time in history, we've got a drug which is powerful enough to treat obesity as a disease. We've never had a drug. Okay, the drugs that worked were banned over a period of time. For the first time, you've got surgery in a pill, or as close to it. Right?
Not a pill just yet. We'll talk to Winslow about that in a bit.
So I think that because of the effectiveness of this drug on all the various things, like Shashank just said, obesity is a disease. Before, we always thought obesity came with type 2 diabetes, hypertension, dyslipidemia, gastroesophageal reflux disease, pancreatitis, infertility. Today we know that various cancers are linked with obesity. So if you can treat obesity, that's the best option. Yes. In terms of medical parlance, I can say anybody who's been struggling with obesity and failed with conventional methods like diet, exercise over a long period of time, or has lost weight and regained it all back, and it's not effective the second time, is probably an advocate for this or a right patient for this drug. Especially those who are diabetic, I think fit the bill right away. Diabetes, which is expanding and getting much worse, like eye blindness, retinopathies, nephropathies, various other things. So I think we're in an exciting generation. I think this drug should be used by all those people who failed conventional methods of diet and exercise.
Those who failed conventional methods of diet, I think that's what the takeaway over there is. Let me bring in Dr. Lakdawala. I want to understand this from you. A lot of people still think of GLP-1 drugs as a shortcut. I've heard this criticism time and again. Every time there's a campaign that goes out with a celebrity, Serena Williams was the latest one, everybody said it's a shortcut. Do doctors like you see it as a shortcut?
So just to round up what Shashank said, I think as Indians and Asians, I believe that our body, the genetics are there. It's the environment and what we do that pulls the trigger. And that's why we've got an entire generation that's becoming obese, that's becoming diabetic. It's almost like we just had the communicable pandemic of COVID. This is the non-communicable pandemic of diabetes and obesity that we are struggling with. As far as the shortcut goes, I would say that obesity is a chronic disease. The moment you say chronic means it does not go away. And ask anybody who's trying to lose 5 or 10 kilos, how difficult is it to maintain that weight loss? And therefore, if someone's with 40, 50, 60 kilos more than what they ought to be, it's always going to remain a lifelong challenge. And therefore, anybody who's looking at a shortcut solution for obesity, which is a chronic disease, I think is talking about something completely different. So if you're looking at a chronic long-term disease, the options have to be long-term, not shortcuts. Shortcuts will never work. That's why a diet or a lifestyle change which will last you a lifetime rather than for a month or for a season is always going to work. So anything along with GLP-1 or its accessory drugs with the diet and lifestyle modification has to be a lifelong change.
So I'm hearing you say that it aids weight loss. It aids a healthier mindset. In itself, it should not be seen. Food preferences, lifestyle choices, in itself should not be seen as the one-stop solution. As
it should never
the one.
Be. We've heard all three of us say it is along with diet and lifestyle changes, not as a standalone.
Yeah. But enough of us actually talking about it. Let's bring in the people who have actually been on GLP-1. I'm very happy that we have two of them who've decided to sort of come out and speak in the public for the first time. Let me first bring in 𝐸𝐸𝐸𝐸. 𝐸𝐸𝐸𝐸 has a very interesting story. 𝐸𝐸𝐸𝐸𝐸 has been on GLP-1 drugs for the past 2.5 months. 𝐸𝐸𝐸𝐸𝐸, आप हमें बताना चाहेंगे कि आपने कब शुरू करा GLP-1 और क्यों शुरू करा?
Approximately 2.5 months back, मैंने GLP-1 start किया, and 6 or 7 years back, I had been treated with bariatric surgery by Dr. Muffy, and I used to weight 170 kgs, 168, 170 kgs, and when I had decided to go for a bariatric surgery, and it was a very successful surgery, and my weight, I came down till 96 kg. From 168 to 96 kg. 168
to 96
kg.
96.
And that was maybe in a year's time. So after that, I had been instructed by doctor's team that I have to maintain the regime or exercise. But what happened, that happiness and the confidence which came suddenly to me, it's what we say. So I was living a very good life, 5 years, 6 years, there was no issues. But post that, again, there was the weight gain started, and it started, and from 96 I went to 114 kgs. Just 2.5 months back, I was 114 kgs, and today maybe I'm 102 or 3. So what happened, that there was no motivation. Again, the weight gain started, and I was not feeling happy with my body, myself. Confidence was going down, down, down. So again, then I said that the God, after I have already mentioned on earth, after my parents, Dr. Muffy is my God. If he was not been there in my life, I would be not sitting here, and I would be on a photo frame, because I was operated before COVID. And if I would have not operated before COVID, I would have definitely died in COVID, because I was high diabetic. My HbA1c was 14 plus. I used to take hypertension tablets. Everything went after that. But now, after that, after 6 to 7 years, when I again started gaining weight, I thought I need to take a step and again come back to the normal weight.
What changed when you started GLP-1?
When I started GLP-1, I would say exactly after not even a week, even after just a second or third day of a GLP-1 first dose, my craving stopped completely. And craving stopped completely for junk foods, basically. मतलब जो खाना हमारे लिए सही नहीं होता है, उसी की craving बंद हुई. Normal food के लिए craving बंद नहीं हुई. So I saw the change in third day or fourth day of my first GLP-1 dose. Then again, it is what doctor also mentioned, that this is a prescribed medicine, and you have to consult your doctor. If you are fit, then only they will prescribe you to take this. So continuously, sir's team is connected with me and keeping track of my food intake, exercise, and everything. So first week, I saw the sudden
But
change.
Nirav, can I ask you this?
Yeah.
You do know that when you stop taking the drug, those cravings will come back.
I know.
That's how it's designed.
Definitely.
So you know that, right?
I know it
So
very
do you
well.
have an exit strategy like...
I have my exit strategy because I'll tell you from last 2 months what changes I've seen in myself. The entire motivation, everything which I had lost, it came back suddenly into me. I have started hitting the gym. I make sure if I'm busy all day, I make sure that when I go home, I hit the gym. I give my 1 hour to myself because I know there is what you said. There is a point of time where I will have to exit this thing, and once I exit, then I'll jump back again. So I don't want to go that.
Yeah.
But this GLP-1 has helped me a lot in getting back my motivation and the strength, and again the confidence back. And definitely I'll keep the
Huge
regime
round of
on.
applause, please. That's quite a journey, and it takes a lot of courage to come out and to actually speak about it. So special thank you to Nirav, which brings me to Blanche as well. Blanche has been at it for 6 months. She was very reluctant, and when I spoke with her before, she said, the challenge with GLP-1 reporting is that I know that even in this room, I know the people who are on it, but they don't want to talk about it. That's another mindset that I will touch upon in just a bit. But Blanche, you spoke, you've chosen to speak about this, right? Tell me why, what changed?
Okay, so I started this GLP-1 drug on the 5th of April, and it's 6 months since then. I had a smooth, great and wonderful journey. I started this because, walking had become so difficult, so painful, and I had a very bad back to add to it. My medical reports were bad, not good at all. My HbA1c was around 6.4, cholesterol borderline high, and I was miserable. Every day I looked at myself, I said, how much can I go? I'm bursting, it was like death for me now, next. So I had to do something. I've tried all kinds of weight loss programs. I've done almost everything. In some cases, I did lose 8, maybe a few kgs, but it all came back. There I had to make that effort on my own. Everything was on my own. But in this journey now with GLP-1, I have the backing of this drug. And I know that it slows down your digestion, so you feel less hungry.
We're actually not sure if it actually slows down your digestion or what happens. I'll come to that in a bit. But clearly, you're not feeling as hungry, and you've dropped quite a few kgs since then.
Yes, I have lost 18 kgs in the past 6 months.
18 in 6 months?
Yes. I felt like I could have lost more, but I have not been such a good person following exactly everything to the T. Maybe around 70% only of what I was told to do. But I have a great team backing me with Dr. Mufi and his team. So I have a dedicated clinical nutritionist, Kathy. So she's always there guiding me, supervising my journey and helping me through it.
Sure. Lakdawala, we cannot talk about weight loss and not look at the lawsuits which have been filed. Pharma industry is seeing its biggest spike because of GLP-1. It's also facing its biggest lawsuit in history because of GLP-1. So regarding the cases which have been filed, which have about 1,200 litigants, there are cases of blindness, of severe pancreatic issues, of other GI issues as well. How worried should we be about that, and why are they cropping if you think this is really doing the work?
Anytime you use a therapy in medicine, it has to be carefully planned. There are phase 1, phase 2, phase 3 trials. This drug has now got into public use, where everybody's using it. We must realize the benefits of this drug for an obese generation. It treats, there's something like MACE, where it decreases heart events, it decreases fatty liver MASH, like he said. It prevents certain cancers in the future. It treats infertility and various other drugs. So yes, I do understand there are a few cases that have been reported of accelerated blindness, pancreatitis, but as physicians, we rule out people with pancreatitis and don't give them this drug. Gallstone disease, anyone who goes on a diet can have an enhanced risk of gallstone disease. So we have to be careful. The important thing to remember is let's not throw the baby out with the bathwater. This is a very effective drug. For the first time, we've got a molecule that really works for an entire disease spectrum of obesity. Let's not get waylaid by these few accelerated reports and keep it there.
Okay, we live in very exciting times. We are the GLP-1 generation, but we've got to be careful. Please listen to your doctor. Please do not self-prescribe. And also, meanwhile, kudos to the scientists who actually have done this miracle. We can't wait to see what GLP-1 does to the rest of the globe as well. Thank you all for joining us on this very, very wholesome discussion. It's so nice to have the industry, the doctors, the patients, all of them together talk about it. Thank you very, very much.